Welcome. It's fantastic to be here in conversation with Bernd Montag, who is Chief Executive Officer of Siemens Healthineers. On this day one, the plenary of the conference, we're really setting the scene, looking at the ambitious plans to improve cancer control across Europe. And I think as part of that, we want to explore what are the unmet needs in cancer control, where we can apply innovation to solve those problems. And we'll get into the definition of innovation as well with Bernd in this interview. So let's just dive straight into this. And Bernd, I know you've thought long and hard and continually think long and hard about these issues. So what do you see as the key unmet needs in cancer control where innovation can make a real difference to the lives of citizens and patients?
So I see basically three things. One is earlier and even more precise diagnosis. Secondly, very personalized, precise treatment schemes. Because I think there's no disease which is so personal, or so individual, for each patient than cancer. And thirdly, it is about really using the untapped potential of digital data and AI. There is still too much hunting for the second opinion. And basically, we have to say that most of the knowledge which is created in each patient episode, in each dialogue between a patient and a physician, knowledge is generated, but in most of the time wasted again or evaporates again. So these are for me the three areas.
Mm-hmm. And they seem to me, I mean, I think they resonate with some of the themes that we'll be picking out in subsequent days and sessions in this conference. We know that downstaging, i.e. earlier diagnosis, will downstage a lot of cancers, which then you have a lot of preventable harm there from late diagnosis. This concept of better understanding of data or better insights from the data we're collecting, I think is a theme that we'll be picking up. So thank you. What in the among all of these, so that there are, I guess there are many solutions to those broad areas you've outlined. What are the innovative? What are some of the innovations that are on the horizon, or that we should be chasing, or that are coming to actually fruition here in Europe that we could be looking to in those areas? And you may want to pick any one of them.
Yeah, I mean, maybe when looking at the three areas, I think when it comes to diagnostic capabilities, we are just at the beginning of what is possible. So the vision I often talk about is, hey, let's look at the possibility of more or less creating a virtual twin or digital twin of the patient, which is then the basis of diagnosis, of therapy selection, of aftercare, so that we really say, well, this is an aggregated model, of that particular patient in this particular situation. And here, I believe we are really just at the beginning, and many new opportunities, whether it is in imaging or in lab diagnostics, will help to get us to this. Plus, of course, the aggregation. I think the close coupling to therapy, with even more precise radiation therapy, even less invasive interventional techniques, or finding exactly the right immunotherapy, chemotherapy based on that patient twin will be a big topic. And I like the statement that cancer care is a team sport. It is always about multiple specialties coming together, but it is super important that they use one data model, and that they use also the capabilities, as I said, of AI and so on, of bringing the existing knowledge to exactly this patient.
Mm. So, and where do we stand in your observation of Europe? Where do we stand in terms of getting that? And I know it's a priority. Conversation we will be having is with DG Connect and the European Health Data Space in this conference, and talking about digital twins. But so it's is it an aspiration? Is it happening? Have we got centers of excellence that are applying this? Where
So,
are proof
so
points?
I think there are centers of, let's say, bright spots of progress. Yeah, where it's really about, the interdisciplinary work and the openness of, using new technologies, especially digitalization, AI, and all the opportunities coming with it. I believe where we have ways to go is when it comes to really addressing it comprehensively. Yeah, and I make one comparison to COVID. In COVID, which by the way, yeah, is a much smaller pandemic than cancer. Yeah, I mean, it's tragic, yeah, that in the last or since the onset of COVID, about a little bit less than 5 million people died. This is horrible. But every year, every single year, we have 20 million more cancer patients. Yeah? And now, when we look at what we did in COVID, or what mankind does in COVID, there are very clear scoreboards. Yeah? What is the infection rate? What is hospitalization rate? What is vaccination rate? And when the topics count, when the KPIs point in the wrong direction, we start working on it. Hey, why doesn't the vaccination work? How can we stop this and this? Yeah. So this holistic view, yeah, of driving progress is
Mm,
not happening to the same extent when it comes to the pandemic we got used to already. Yeah. And I
mm,
believe to a large extent it is not so much about just the bottom up and the center of excellence and so on and so on. It is really about bringing the structure to work, yeah, and making that comprehensive way of addressing it possible. Yeah, the
mm,
landscape, I believe, is often too fragmented,
mm.
and especially when it comes to innovations in the digital space, you need a big resonating ground, and you cannot just digitize an island. Yeah.
Right, right. So there's economies of scale from large scale data shared across many different, etc. That there's, yeah, yeah. So okay, this is an interesting. You've brought out an interesting point that we've had a tragic pandemic, or we're in the midst of a tragic pandemic, where there has been a response, a coordinated response. There's been investment, and yet in the face of, as you say, this slow burn but deep issue, which is causing so much harm and suffering, which is cancer, we haven't we're not getting that same attention, I suppose. So and attention towards innovation, and attention towards data to drive, and knowledge and coordination between different innovators to tackle the problem. This idea of dashboards and KPIs. You've mentioned many things. What is how how do we get that attention onto cancer, I suppose, is one question. Or how do we incentivize that kind of, it's a mixture of leadership, investment, um, they're coming together to drive that, given the scale of the problem that you described.
See, I mean, my hope is that when we look at post-pandemic times, that I think what the pandemic has shown is that healthcare is a super critical aspect of the welfare of a nation, um, and that a state-of-the-art infrastructure is not a cost, yeah, but a
Mm,
prerequisite
mm,
for well-being, but also for competitiveness of a nation. And I believe that it has shown a much bigger openness
mm,
for technology and science-based medicine, yeah, where there's
mm,
sometimes a little bit of a skepticism and so on and so on.
mm,
Yeah.
mm,
And on the other hand, I also see, I know it's a little bit of a commercial for Siemens Healthineers here, but you see also, companies like us which haven't been there 5 years ago. Yeah, I mean, we were part
mm,
of a bigger conglomerate, if you wish. Yeah, but now
mm,
we have put cancer care also with the combination with variant more or less as at the center of the reason why this company exists. Yeah. So, and if you add all this up, yeah, I think this openness, yeah, towards digital solutions, the digital natives coming in, and so on. I believe there is a lot of topics, yeah, which will make a new momentum possible. Yeah,
mm, mm,
and it will not be the single thing which does the trick, but I believe
mm,
the overall combination of it it will make a big difference.
mm. And on a related note, I think is I suppose when we think of, you're describing innovation in a much broader sort of sense than maybe is traditional within healthcare. I think in health, traditionally, when people thought of innovation or R&D, it's always been around pharmacotherapeutics, and indeed we have very mature systems in place to ensure that pharmacotherapeutics are delivering, are safe, effective, delivering value within the
Yeah,
health system. The kind of thing you're talking about is, maybe you'll agree, maybe you'll disagree. It seems to me the health system itself is not particularly ready to know what to do if someone approaches them with digital solutions or with a program for data interoperability and sharing and these kinds of infrastructural innovations, you might call them. What what needs to happen on the demands on the health system side? Do you think to make this more, to deliver
yeah.
it quickly and deliver
And
value?
yes, so I believe, I mean, one I think positive aspect is also that let's say we see on a global basis also that a trend towards providers either consolidating or teaming up. Yeah, so we have been
Mm,
the landscape has been very fragmented for a while. Yeah, but when you now look at I mean, in the US, the trends towards more consolidated health systems with also different payment schemes, yeah, with value-based care, sometimes capitation. When you look at the completely other side of the spectrum in terms of organizing healthcare in China, with the Healthy China initiative, where the government wants to drive comprehensive cancer care. I think the one positive aspect is, or one thing one needs on the receiving end, so to say, is there needs to be an agent. Yeah, there needs to be someone who wants to do this, and this cannot be just a single small practice. Yeah, this needs
mm,
somebody who thinks in a system context. Yeah, and this is happening more and more, and this also helps us, yeah, to really move change the system. Yeah, because I mean what you rightfully said, innovation for us in Siemens Healthineers, in our example, is not about this one new drug or so, yeah, which is always important. Yeah, but in the end it is about what is the right treatment for the right patient at the right time, and how do you enable a system, yeah, which
mm,
ensures that this always happens. Yeah, so this is, I believe, the real innovation, the systemic innovation we need to work on. And a
mm,
systemic innovation also, of course, means there need to be people on the receiving end, so to say, who can implement these systemic innovations.
yes.
And this cannot necessarily be politicians. And I don't mean this negatively when it comes to politicians, but they don't operate the hospital, yeah,
Mm,
or the health network. Yeah.
mm. Okay, so we're pretty much out of time, Bernd. I'll give you the opportunity, I guess, any sort of key takeaways you want to wrap up with from this interview. I mean, we've had a very rapid sort of canter through all of these issues, but is there anything you want to kind of leave us with?
See, I think that one thought which we sometimes forget is that it's very much about how do we make sure that the knowledge which exists on one place can reach another place. How do we make sure that what worked in a patient in Japan works will be used in Brazil a week later? Yeah. How do we make sure that when you are diagnosed with cancer and you are in a rural area, that you can be sure that you get the same treatment as you would get in a super well-known academic medical center? Because in the end, yeah, the tools can be the same, and it's about how do we spread the knowledge and how do we build on the knowledge which is generated. Yeah, so it's maybe a bit of a philosophical remark. Yeah, but I do believe that this is the core of the opportunity we have in front of us.
That's fantastic. I'm reminded of the Chief Knowledge Officer of the UK National Health Service saying that knowledge is the enemy of disease, and that's kind of what you're saying, is that that's where we need to apply it. Thank you, Bernd. Fantastic.
Thank you,
for
Vivek.
joining us.